Hi, this is Nancy. I'm your parish nurse, and I'm here today to talk to you about something that's very dear to me. It's strokes. This is going to be talking about 10 tests that can measure your stroke risk. We're going to do everything we can to try to reduce your risk for a stroke. We're not going to talk about what causes a stroke, how do we really recognize a stroke. That's going to be on other days. This is 10 tests that measure your stroke risk. All right, let's get started. This is the Heart and Stroke Foundation finding answers to life. A stroke may seem like an unpredictable event, and to a large degree, it pretty is unpredictable. In 2018 alone, 1 out of every 19 deaths in the U.S. were attributed to a stroke. In 2016, someone died from a stroke every 3 minutes. But however, a few medical tests can help us determine if we are a high risk for a stroke. And why do you need to know if you're at risk for a stroke? Because we want to be able to reduce your risk for a stroke. And that's what we're here for. I'm going to be able to check your blood pressure, your pulse ox, your oxygen, everything we talk about today. We're going to be able to test most of it and address all of it. So let's look at these simple tests to measure your risk for a stroke. Modifiable risk are things that we can change. High blood pressure, diabetes and high blood pressure are two of the most common things that are cause or risk factor for a stroke. Smoking, high cholesterol, AFib. AFib is an irregular heart rhythm. The heart is normally meant to beat lub-dub, lub-dub, lub-dub. When you have AFib, and normal rhythm is 60 to 100, AFib can beat anywhere from 40 to 100, back to 40 to 50, and instead of lub-dub, lub-dub, it's dub, dub. That is what AFib, heart failure, obesity, inactivity, diet, alcohol, drug use, those are all things that can cause clots. There are 2 types of strokes. We're not going to go into big depth, but 2 types. Ischemic, which means blockage, a clot. A clot forms usually in your lower extremities, in your legs. Every minute your blood flows from the tip of your toes, top of your head, to your heart. Every minute, that's what your pulse is. As it's flowing through your veins, coming from your body, there's no oxygen in it. It's picking up debris, dead blood cells, some debris. It dumps that all in the heart. If there happens to be a clot in your leg, which is where it usually occurs, it's going to dump that in your heart, which can cause a blockage. If it's small and gets caught in the heart, you have a heart attack. If it's even smaller and the heart says, no, I can pass it on. And he passes it on to the lungs because now you're going to pass that blood with no oxygen. You're going to breathe out. Then you're going to breathe back in. Now your lungs passes it back to the heart, which is the large part of your heart on the left. And now the left side of your heart pumps it all the way out to your body. Well, that clot has been pushed out. It's now going to go up to your brain, which is the last stop. One other thing that I didn't put on here is COVID. People that were usually in the hospital that suffered from COVID would develop clots. Those clots indeed could cause them and did cause them to have strokes. That's why one of the treatments was to put them on a blood thinner. Heart auscultation. What is that? That's when you go to your doctor and he takes a stethoscope and he listens to your heart. What he's listening for is to see, is there a steady rhythm? Is it beating lub-dub, lub-dub, lub-dub? Or is he getting that abnormal rhythm of AFib, lub-dub, dub? Or is it beating in even faster? I said the normal heart rate is 60 to 100. Well, some people, what if their heart rate's 120, 130? Then the heart's beating too fast to fully empty when it brings it up from the body into the right side of the heart. Those irregularities are things that can cause a blood clot. Luckily, these irregularities are easily detected and easily treated by your doctor. If you want to come to the church here, then I will be checking your blood pressure. I have a very strong stethoscope. I also have a pulse ox, which is going to check your oxygen level, your heart rate, and it also does like a mini EKG on it. I'm also going to listen to your heart and listen to your carotid, which we're going to talk about in a minute. So again, all these things we're talking about, we can actually check here as your parish nurse. I want to take the fear out of it. I don't want you to be afraid. I want you to be able to ask questions. I want you to feel comfortable. Another thing that your doctor can order, usually does every year when you get your wellness checkup, is an EKG. The EKG is going to monitor your rhythm. As you can see on this little example here, you see a peak, you see a valley, you see a bunch of little peaks, then you see another great big peak. That's the steady rhythm of the heart. The peak, that whole little pyramid there, is your heart pushing the blood out, the left side of your heart pushing the blood out with oxygen to the rest of your body every minute. And that needs a lot of force to do that. So there are things like clots that are going to get pushed out too. One of the most common heart rhythm abnormalities, which we already talked about, is called the AFib. Again, this increases the forming of blood clots that travel to the brain and can cause a stroke. But we can treat that. We can recognize it. We can treat it. The carotid auscultation, your doctor, or maybe the nurse when you go in for your wellness check, usually when I'm assessing a patient, I check their necks. I tell them we put their fingers right here. I want them to feel it too. And if you press gently, you can feel your pulse. It's right up from your Adam's apple. You can find your Adam's apple and go right up in between. You can feel a nice steady little pulse there. That is your carotid. Remember, the blood's flowing every minute, can have that clot. That clot can get stuck in our carotid, or the carotids can become filled with plaque. We can hear that by using our stethoscope, the bell end. The bell end, we should hear, or the doctor as he's listening, should hear a steady flow, swoosh, swoosh. If we hear a turbulent flow, that is usually attributed to a blockage, and we want to do further testing. Again, when you come for your blood pressure check, we're going to listen to your carotid, and I'm going to let you listen because I want you to be able to hear and understand what I'm listening to so that you know what I'm talking about and saying, oh, I got it. I see what she's saying. So that's what we'll be doing. Fat and cholesterol levels. Your doctor must talk about this all the time. I know that we do. Cholesterol only comes from your diet. And fat in your diet. That's why we'll say everything that you eat is a fat, is a cholesterol, is a sweet. Carbs. Carbs are rice, bread, puddings, candy, pastas. Those are carbs. Cholesterol comes from the fat in the meat. Lean cuts of meat, lean cuts of pork, lean cuts of beef, chicken, fish. Those are things that help reduce your level of fats. The normal fat for cholesterol that your doctor likes to see is 200. Again, only comes from your diet. Your HDL, which is the good guy, we like him to be 50 or above because his whole job, he's Pac-Man. His job is to grab that fat when it comes in and emulsify it like Dawn dish detergent. The LDL, that's the bad guy. He builds up and he causes that plaque that you're seeing on that little diagram there. And your triglycerides are long-term. This is over a long term. How does your body handle the fat that you eat? A lot of this is hereditary. We talked about the non-modifiable. Your age. You can't change your age. You can't change whether you're a female or a male. You can't really change your genes. Mom and dad, grandparents, that's where it came from. But we can modify our environment. We can reduce it. There are things that we can do. Medications we can take, diets that we can do. I would like to do another YouTube for the church just on fat and cholesterol levels and diets, things that we can eat, things that'll work. So that may be coming very near in the future. Echocardiogram. This is not a standard test. This is what your doctor is going to order if you want. Usually, now, we like a control point. The doctor will do it during a wellness check when you reach a certain age. For example, my doctor does it when you're 65. If there's a family history of heart attack, stroke, those are things they want to say, well, let's get a control point. An echocardiogram measures the amount of blood that's ejected in your heart. Remember what I said? The blood comes up, it's dumped in the right side of your heart. The right side of your heart passes it to the lungs. You breathe out, breathe in. Now the blood comes back in, goes into the left side of your heart. The left side of the heart has all that oxygen now. It's all filled with all the nutrients and ready to go to your body. The left side of your heart ejects it out. That's that peak that you saw on the EKG. That is your ejection fraction. The doctor likes to see 55 to 70% is normal. It's something that they do check when they're in the hospital. If the person's having difficulty breathing, if they go, oh, I'm so out of breath, I walk to get my mail and I'm out of breath. Is it always the heart? No, it can be other things. It can be a virus. It can be that you're just fatigued, but it can be the heart. And we like to do all these different tests to rule out so we can keep you as healthy as possible so you don't have to come to the hospital. So a doctor may order an echocardiogram, and that's what it is. It's usually a screening. Blood pressure, that's what we will check here. Again, I have a very powerful stethoscope. Normal blood pressure, I really hate it when they say normal, is anything for systolic. What is your systolic? That's the top number. Usually 120 is normal. Now, when you saw that EKG and you saw that pyramid, that peak, that is your top number. That is your systolic. We like it to be 120 to 139. That's like a borderline. Your diastolic is your bottom number. That's the number we like to be less than 90. That usually is in line with your heart rate. So your heart rate and your diastolic, because it's resting, remember? We said that your heart pushes the blood into the right side of your heart. That's when your heart rests, so it can take all that blood. That should match your diastolic. When you come in, we're going to check it. We're going to go over it. We're going to let you understand everything that's happening in your body, and we can do it on a regular basis. It'll make your doctor happy because you're going to have a nice list. We even make a nice sheet that says, this is my blood pressure checks. Blood sugars. Again, high blood pressure, diabetes are two of the leading causes of stroke and heart attack, and huge risk factors, of course, for COVID because it lowers your immune system. Individuals with diabetes are more likely to die of a stroke at a younger age. We want to know your A1C. A1C says, how is my body handling my carbs over a long period of time? I am a diabetic educator. I have lots of information and pamphlets. Would be more than happy to go over a diet, a meal plan, to help you. One of the things that we give to our patients, and I also, in the May issue of the Grapevine, am going to do a paper on how dark chocolate benefits your body. One of the ways it benefits your body is to maintain your blood sugar. It also helps prevent heart attack, helps to prevent stroke. It's a way we can maintain it. We're going to monitor your blood sugar if you would like that monitored. But also, if you have blood sugar that's higher than normal, the doctor's going to be aware. He might assign medications. He might just say to use diet and exercise. There are things that we can do and talk about to help you to manage your blood sugars. Independent self-care. This is something that's near and dear to me because I work on the rehab unit at Mercy Hospital in Lorain. That's where people that have had knees and hips. And these are things that we encourage and really want people to do right after they've had surgery, any kind of surgery. 2 hours after you've had your surgery, we're going to be getting you up. We're going to be walking you. We're going to, because why? We don't want a clot to form. By getting you up moving, your blood's flowing, there's less chance for a clot. Declining ability to independently complete your activities of daily living, getting dressed, brushing your teeth, brushing your hair, taking a bath, have been shown to be a stroke predicator. So we want to make sure that we can keep you as independent as possible. You might say, but you know, I had my hip done. I can't reach over. I can't bend over and tie my shoe. I can't pull up my socks. To prevent a stroke, my doctor has advised me to wear support stockings. We can get you adapters to help you to pull up your socks, to help you tie your shoes, to help you do your pull-ons. There are things that we can do, and as your parish nurse, this is what we're going to do. I'm going to do everything I can to reduce and lower your risk for getting a stroke. Walking speed. The average person walks 4.5 feet per second, which is considered optimum to reduce your risk for a stroke. 67% of people, 67% stroke increase for people that walk less than that. That's according to the Albert Einstein University. That's kind of lumps everybody in together. I'm old. I'm short. I'm 4'10". I like to say I'm 4'11", but I'm only 4'10". I have a difficult time walking 4.5 feet per second, but I walk very fast. It's the speed and the rapid and the time that you walk. Walk in your house. I don't care how much walking you do. Walk out, get your mail every day. Walk around your house. Walk around your living room. If you have stairs and are able to do the stairs, walk up your stairs slowly, holding on to the rail. Those are things that increase your walking. What does walking do? It exercises your heart. I also, in the grapevine, just did on exercise that we can do to increase our joy, to increase our happiness, to help us to stay healthy. Sit in your chair and lift weights. I'm not saying weights. You can lift a can of peas in each hand. You can, no, don't lift your dog. I don't want to see you lifting your dog. Yes, I've seen people do that. No, please don't do that. But lifting weights, that exercises your heart. So, walk as much as you can, as often as you can, at least every 2 hours. Why do people that fly a lot have a common occurrence, not just risk, but occurrence of strokes? Because they are not getting up every 2 hours on that flight and moving around. It's critical that you not stay seated for more than 2 hours without getting up, stretching your legs, stretch your back, and walk around. We want to prevent those clots. The majority of the clots occur in our legs. So when they're on the flight and they get up in a few hours or even the next day, they go, wow, my calf is sore, it's a little swollen, it's a little hard to touch. That is concerning for a DVT, deep vein thrombosis. One calf can be even larger than the other and more firm to touch. That is suspicious for a DVT. It needs to be checked out. So that's why we want to keep you up, moving around at least every 2 hours. Standing on one leg. This is from a study in Japan. Japan, in their workspaces, have their people exercise. They actually have their people do this. We don't. I'm not sure. I'm 100% sold on get up and walk around every 20 seconds. What we do with our patients that are in the hospital, we stand in front of them, holding on to them. We do have them raise one leg and stand for another for a second or two to see how the pain is in the leg that had the surgery, to see how their balance is. Are they more off balance on one side? Is there a middle ear problem? And the person says, you know, I get dizzy a lot when I just stand up. Is that your orthostatic blood pressure? Is that inner ear infection? Is that wax in their ear? There's things that we can do. But standing on one leg for 20 seconds, I'm not sure I can do it. I already told you I'm old. If you want, I'll try it. But I'm pretty sure I'm going to fall, and you're going to have to pick me up, and that's not going to be any fun. But the Japanese strongly feel that if you cannot stand for longer than 20 seconds, you're at risk for a silent stroke, which means a stroke you're just not aware of. And we're going to talk about that in a second. We have stroke awareness. Lorain County is the leading county in Ohio, for example. That is the leading county for strokes. Stroke awareness, I want you to learn this acronym. If nothing else from this video, please learn stroke awareness, act fast. F stands for face. One side of the face can droop, go down a little bit. It can be transit, down and back up. And you go, wow, did I really see that? If it's a TIA, transient ischemic attack, meaning a clot occurring that's transient, it can be down and then back up. Down, then back up. And you go, did I really see that? I'm not sure. If you're not sure, the fail-proof is the arms. A stand for arms. Have the person raise their arms straight out and say, okay, lift your arms for me. They'll lift one arm and it'll keep going. The other arm will slowly drift back down to the body. And they'll go, wait a minute, I didn't do that. I didn't make it drift. And that is on the side that's been affected and blockage by the clot. Speech, S stands for speech. The speech can be slurred. It can be garbled because their mouth can be dropped. It can also be word salad. Word salad is an example if you ask the person, are you okay? Did I see your mouth droop? And they'll go, cat, dog, run. And you go, what? And the person's thinking, I thought I was saying, I think I'm fine. That is called word salad. That is a strong indicator, immediate indicator that we have a problem, that a stroke is occurring, or even a TIA. Doesn't matter, TIA, stroke, full-blown stroke, we're still going to call 911. T stands for time. You have 3 hours to get to the hospital and have TPA administered. TPA is a clot buster that has to be administered within a 3-hour time frame, can only be administered if the stroke is ischemic, which is the clot. It cannot be administered if the stroke is hemorrhagic. We really didn't talk about this. I plan on a separate YouTube where we do go in more in depth with stroke symptoms, different types of strokes, how to recognize each different type. A hemorrhagic usually occurs when the person hits their head, has a car accident, falls down, hits their head again, or if they have a weak vessel and it bursts. If it's hemorrhagic, we cannot do a clot buster for fear that they would bleed to death. So if you get to the hospital within the 3 hours, you have a wonderful chance of a full recovery. That's why we do the 3 hours. So you're going to, if you notice any of these symptoms, any at all, you're going to call 911. The person might say, no, I don't want it. You're going to call 911. I am a CPR instructor, and I'm going to ask the church if they would like me to teach a class where you could get certified as a first responder in your church, in your home, as CPR or first aid, as a lay person, but it would certify you. You would be fully certified to recognize any of the first aid or strokes or heart attacks. So we'll address that at another time too. You're going to call 911. You're going to stay with the person. You're going to try to keep them calm, and everything's going to work out okay. The team is going to get there, the CMS, they're going to immediately begin some medications, they're going to run some diagnostics when you get to the hospital, and I'm sure you've heard it over the loudspeaker. It's going to be say code BAT, code BAT, code BAT. Code BAT means brain attack. A team of individuals that are trained, educated, do this all day long. Jump into action. They're going to be there right at your side and doing everything possible to make you have a full recovery. So that's our plan, and that's it on the 10 measures to gauge your stroke risk, and that's what we're doing. So we are a community. Again, I'm Nancey Brock. I'm your RN Parish Nurse, and we are a community parish nurse. We will help each other. If you need to get in touch with me, if you have questions, comments, concern, you can send an email to Nancey, Nancey, at corucc.org. You may call the church anytime, 440-331-0834, option 4. I'm here usually on Thursdays between 9 and 2. Any other time you can call, it will go to my voicemail, which comes to my email. I will get right back with you as soon as I can. If Thursday is not a good day for you, let me know. I will make myself available to you. Most important to me is helping you in whatever you need to help you to prevent a stroke, a heart attack, keeping your blood sugars under control, monitoring your blood pressure, keeping you healthy, happy, and doing the things you love to do, like going to church. Well, thank you for letting me be part of this, and I look forward to hearing from you in the very near future. Thanks again. Bye.